If you're concerned about the appearance of your chest, listen to this video. Gynecomastia, or some people call them man boobs, is a condition that's extremely common that I see all the time in my practice. Basically, this is fullness or any unwanted extra material in your chest that makes your chest not look like how it should look. Extremely common. Gynecomastia literally means the presence of abnormal breast tissue in the chest, and this is a very, very common issue. Many men have it. In my practice, is the second most common reason that I might see a patient in my office that's considering surgery. This is Dr. Shim Ching. I'm board certified plastic surgeon. I've been doing this for about 25 years now. I practice in Honolulu, and what makes me uniquely qualified to talk about this is that I have done thousands of these kind of cases, helped many men with this problem. Now, most of the time we don't know what causes this. It's usually the case of what we call idiopathic, meaning we don't know what caused it to begin with. There are some conditions, such as tumors or medical conditions, that might cause this, but that is really the vast minority of patients, very rare. It's usually most commonly what we call idiopathic, or something that just occurs in certain men. Sometimes I do see patients who've done steroids for bodybuilding, and that also can cause this. We do know men create a little bit of female hormone in the testicles, and that could possibly be the reason why breast tissue develops. The other reason is that testosterone can be converted into female hormones, estrogen, by the body as well, and those are the reasons why somebody could develop breast tissue. We also believe there's a balance between the male hormone and the female hormone in the body, and it's possibly that the male hormones have less of an influence on the chest in certain individuals, and this causes the development of breast tissue. When I'm dealing with this problem, what I have to assess is whether there's fat, or what we call glandular tissue or breast tissue, because both things need to be removed differently. Fat can be removed with liposuction very easily, usually through an armpit incision, but that glandular tissue needs to be surgically removed. Most commonly, there's going to be a combination of the two. So I have to address the problem with both liposuction and glandular tissue. I do see a lot of men who've had this procedure done before, and unfortunately they're not happy with the results. And it's usually because one or the other wasn't done. The previous surgeon just did liposuction, or the previous surgeon just did glandular removal. And I feel that most of the time I'm combining the two in those patients to give them the best results. So if you're considering the surgery, a couple things to consider. One is that make sure your surgeon has assessed whether you have only glandular tissue or only fat tissue, or a combination of both, and ask him or her how he or she is going to address both of those things. Fat can extend all the way to the sides, even the side of the chest. You cannot cut that out. You have to do liposuction. Similarly, if somebody is only going to do liposuction, you're going to have that breast tissue right underneath the areola that can't be sucked out with liposuction. Somebody has to do both things to give patients the best results. The other thing you have to watch out for is where is the scar, because the whole point of the procedure is to make a man completely comfortable with their chest so they can walk around shirtless. That's what most men want from this procedure. If you have a big obvious scar on your chest, that kind of defeats the purpose of this surgery. In plastic surgery, we're always trying to hide scars, minimize scars, make the scars least visible as possible. So what I do is I place a scar within the areola. That's a different approach than most surgeons, and I find that that scar heals the best. The usual approach is a scar beside the areola, right at the edge, and sometimes that heals really well, but if you have a visible scar there, it's going to be very obvious that you had this surgery done. The other thing to watch out for is taking out too much. If you take out too much from the chest, there can be indentations, irregularities. Again, that's something that looks like surgery was done, and we want to really avoid that. One thing I've noticed is that the skin has a certain thickness. When you pinch your skin, there's a certain thickness to the skin, because there's a skin and then there's a layer of fat underneath. The areola, however, there is no fat underneath the skin of the areola. It's really quite thin, and underneath there's actually a little bit of breast tissue. A little bit of breast tissue is okay, all men have it, but you have to maintain that breast tissue underneath the areola, since there's no fat in between the skin and the breast tissue. If you remove everything, there's going to be an indentation there, and that's the other problem that I often see that I have to fix one way or another after a patient has had surgery and they're not happy with it. So second point is make sure you ask your surgeon how much they're going to leave behind. Do they realize that underneath the areola there is no fat layer, so you have to leave a little bit of breast tissue so there's no indentation? So cover the 3 most important things to consider before getting any sort of gynecomastia or chest contouring surgery. 1 is, how is the surgeon going to address my problem? 2nd is, where is the scar? 3rd, make sure enough is left behind so it doesn't look like you had surgery. Thanks for watching this video. Give us a comment, give us a like down below, subscribe to this channel, and stay tuned for more content like this.